All right, thank you, Hunter. Well, it's now time for our weekly political segment, KVUE Face Off. Joining us this morning, we have Progress Texas Communications Manager Tara Pohlmeyer and Matt McCoviak, who is the chairman of the Travis County Republican Party. Thank you both for being here with us today.
Thank you.
Sure.
Yeah, you know, obviously one of the things that we want to talk about, I mean, you can't escape coronavirus right now. It's the big talk. Even right now, we have the state lawmakers, the Public Health Committee for the House meeting right now. But one of the things that, you know, we're starting to hear more and more about is the economy and the impact of the virus on the economy. We just got a statement yesterday talking about Texas's economy is strong. Matt, can we weather this?
Yeah, I mean, I would argue in the last couple of days the drop in oil prices is far worse for our economy and for the state budget than what's happened with coronavirus. But look, there are huge effects. These major events that get canceled, South by Southwest, for example, doesn't just affect that organization and their workers. I think I saw they're laying off a third of their workforce, which is terrible news for those people. But it affects all the businesses that rely on events like South by Southwest. Look, the good news is that the United States is not seeing the effects of the coronavirus to the same extent you're seeing in a lot of other places in the world. South Korea, China, Italy, Iran, where you have really widespread outbreaks. We are seeing more testing this week, and so the number of cases are going to jump. We're trying to prevent community spread with the health measures that you're seeing across the country. And I do think because the economy's come down a little bit, because the stock market's come down a little bit, the administration is trying to work in a bipartisan way to provide either a payroll tax cut, loans for small businesses, paid sick leave. Those kinds of ideas are on the table, and I hope that all the parties can come together and work together over the next few weeks to try to pass some of those stimulative measures.
Yeah, one of the things we particularly heard about was the president talking about a possible payroll tax cut for people who are in industry impacted by this. Tara, I would imagine that's something that the Democrats could get on board with.
Yes, I think the issue right now is that Trump is not talking to Democrats about his plans. He is only talking to Republican leadership. I think this entire just crisis that we're going through as a nation, as a world, underscores the need that Democrats have been pushing for years and years and years for paid sick days, for expanding Medicaid. We have seen Republican leadership here in the state, from Governor Greg Abbott and from our state lawmakers, refuse to expand Medicaid in our state and refuse to pass measures like paid sick days, and instead attacked local ordinances that provide for paid sick days for workers. And so we will need that bipartisan support that Matt is talking about, where Republicans come across the aisle and work for some of these things that progressives and Democrats have been pushing for quite some time.
Yeah, you raised a very important point, and that's about our high rate of uninsured folks here in Texas, highest in the nation. Matt, how do we combat that? Because if this does, we're constantly hearing that even the U.S. Surgeon General this morning said it's going to get worse. I mean, that's just the reality. You're going to see more cases of this and fewer cases. There are folks who can't go to the doctor.
Yeah, and look, I would start by saying that, the Democrats made lots of promises when Obamacare passed that it was going to cover lots and lots of people. I recognize that Texas decided not to expand Medicaid. The reason for that is that it's a 100% federal cost share for 1 year. For 3 years, I think it is, and then it drops to 90%. That 10% difference is billions of dollars a year to our state. So that's a real challenge. And so, yes, the state has not done that to this point. It's possible they could look for a model like what you've seen in Arkansas, which is more of a free market model where you could take Medicaid dollars, if you block grant that money to the states and let the states spend it the best way that they can for their population, I think that's an idea that would have some support, but Democrats haven't shown an interest in that at the federal level. So I don't see there being much that's going to occur in the next few months as it relates to coverage, just because we're not in session until January. We'll see if the feds, do something additionally. They're trying, I think, to look for ways to help workers who are being directly affected by the coronavirus. If you work in an hourly job and you can't go to work anymore, or business has been cut back because of the virus and the steps that people are taking, a lot of people are living hand to mouth, living week to week, month to month, paycheck to paycheck. And so I think the administration is looking for ways to try to provide support to those kinds of people and potentially to industries that have been affected, like the cruise industry.
Do you think that there is a move to then, maybe there will be a push after this to have those sick days and to not, obviously the ordinances that were passed by Austin, San Antonio, I mean, they were knocked down in court, but do you think there'll be a push or a renewed sense to get those things done?
I think the question is, do you want government to tell businesses what kind of policies they have to have for their workers, or do you believe businesses should have the choice and the government can say, you know, this would be a good idea, we would perhaps reward companies that do that, but not require it. The paid sick leave ordinance in San Antonio was opposed by every single business group in the city. It was a total disaster. It's a disaster for the fast food industry that simply cannot make the margins up by paying paid sick leave because the margins are so low in that industry. I think that sick leave, if I remember, allowed people to call in sick, you know, well after their shift has even begun, right? If you cannot run a fast food business not knowing when your employees are going to show up and when they're not. So there were some challenges with the way those things were constructed, and if they're not constitutional, they're not constitutional.
Tara, I would bet you would argue the government tells businesses what they can do in other aspects of their jobs.
They do.
How they run business.
But I think when it comes to paid sick days, we know that workers have earned these days. A lot of workers should not be coming to work sick, especially, you know, in our current climate that we're going through right now. And so I think the need for paid sick days is greater than it ever has been before. And we need local governments, we need our state government leaders to recognize that need and to make sure that our workers are protected when it comes to their livelihoods and their families as well.
Yeah, it'll be interesting to see how all of this is going to impact those types of policy discussions and conversations from, you know, expanding Medicaid, Medicare to paid sick leave. I thank you both for joining us this morning. We certainly appreciate it. If you guys missed any of this, don't worry, you can catch it on KVUE.com right after.